Boom. All right. Well, hello, everyone. I'm glad you're here, you're watching and or listening, and excited to have my guest with me today. This is the first time we've formally met, Zoom met or face to face met after a few years of corresponding. And so my guest today is works at a company that I love, whose products I love, called RockTape. If you know me, you know this is the brand I use and that we've used with so many people around the world. So, without further ado, I want to introduce my special guest, Dr. MJ Adamcik. Welcome, my friend. How you doing?
I am awesome. Thanks so much for having me. It's good to be here.
You are awesome, by the way.
Oh, such things you say. You're pretty great yourself.
Well, it ain't about me, it's about we. And speaking of we, um, our mutual friend, Dr. Steve Capobianco, we'll call him Capo, he's such a cool guy. And I've gotten to know him over the years. A lot of stories about being with him, which are all great. He's such a great guy. But he introduced me to you via emails. I think it's 3-4 years ago now.
Yeah.
And I just want to put this out in public too, that we appreciate what you have done, what a force you are in the community and helping people in general, and helping people in schools and students and this and that, but also for helping and supporting our foundation, you and RockTape. We thank you because you have allowed us to help people all over the globe, literally in the travels. I travel with RockTape and then we give it away. So thank you.
Well, we're very happy to be a part of, the awesome things you're doing. I think most of us, when we get into the healthcare field, our goal is we want to help people. And, I'm in a very unique position that I can help a lot of people help more people, which is pretty awesome opportunity to have. And it's just been really neat watching the things that you've been doing and just knowing that, we've been a small part of supporting that. And, definitely happy to be along the ride with you.
Thank you. Yeah, it's really been cool. I mean, one of my favorite things, and I'm just going to go off for just a second here because that's what I do, even though this is about you, this interview. I'm going to tell you about me for a minute.
Please
So,
do.
but it has to do with you and it has to do with RockTape. And it has to do with, I love when we're able to use something that's really just pretty simple. Simple doesn't always equate to being easy, like knowing how to use a product or whatever. But when you learn how to do it or whatever, sometimes something simple can make a big difference. And this can pull somebody from feeling defeated, hopeless, down to like, boom, unstoppable, optimistic, and hopeful. Sometimes it's as simple as tape, maybe across this upper region here where they're just having some pain, or they're in Parkinson's. A lot of times posture goes forward. Of course, a lot of us as we age, that seems to happen anyways, but Parkinson's becomes, generally speaking, more exaggerated. And so when we can pull them up out of that with a little sensory input reminder tape,
Yeah.
and they feel better, I mean, you know what, it something like that makes a big difference. And then of course, especially in Mexico where I've been a lot, I mean, they have a lot of RockTape they've used there because of you. Thank you. So
Well,
I went,
yeah.
I went down there with like a small suitcase full of it on one trip, and the customs, they snagged me for like $40. I mean, trust me, it was worth of $40 to go in and help people, but they didn't understand what it was for. And I'm trying to, I'll tape you, Mr. Customs man, senor.
Right.
Yeah. But anyways, no, it's cool. It's just so cool.
Yeah.
So, yeah. So tell us a little bit. We were talking before we went live. Oh, and our friend Laura, who lives with Parkinson's, an amazing person in Mexico. She's watching now. Hey, Laura, what's up? ¿Cómo está? Um, you've been with RockTape for a few years now, and what are you doing with RockTape? You do have a unique position there, and I'd love if you would share a little bit about what you do.
I do. I'm going on my 8th year now. It's almost been what, 7? Yeah, 8th year, I think is starting. So my official title is clinical relations manager. My fun title is the Grantor of Wishes. Um,
I love that on your Instagram. Yeah.
it came about as a joke one day. I was saying, I feel like the genie. People just say, "Hey, we need a little product support here or there." I'm like, "Boom, wish granted." Boom, and then it just sort of evolved from there. So I handle a lot of just direct support to our customers, medical pros and students, if they've got, just different things going on, either in or outside of the office, if they're going out to an event, say they're taping people up before a running event or an obstacle course race, or doing, some sort of community service, public talk about, taping up for posture and that kind of stuff. We can provide resources for them, sometimes some product or marketing materials, things like that, just to help them stand out a little bit more, get them pointed in the right direction, and just get them set up for success. I also arrange a lot of the events that we do right now. Not a lot going on with that, but when we go to conventions and shows, that kind of stuff, if you ever come see the RockTape booth, chances are I'm there. Or if not,
Mhm.
I worked with our team to get everything coordinated and figured out, what are we going to send, who's going to be there, what's the plan, and what are we going to look like. So I'm a lot of I've got a lot of public facing
Mhm.
opportunities, which is, it's allowed me, the chance to meet many of our providers, head on, and find out, the different things that they're doing. Hey, how can we, be a resource for you? And
Sure.
it's really helped identify a lot more opportunities if someone just comes up and in passing, kind of like you, hey, I'm doing this, amazing,
Yeah.
project going on, and we're using your tape, and, oh, hey, well, let's get on board. Let's find out a little bit more about that and see if, we can help you out even more.
Yeah. I mean, not to be self-promoting, but if they know me, they know I wrote a book. There's a chapter on rock tape in this book, and I wrote a little bit of it. But Capo and Agox doctors provided a lot for that too. Uh, just beautiful contribution that I could not have articulated like that, not even close. But it does make a big difference, you know. I mean, my first rock tape course was at Project Move
Oh, yeah.
in Littleton, and Dr. Perry was teaching.
Oh, great facility, great instructor. Boy, you
Uh,
hit the jackpot on that
I
one.
did, man, and I already knew Perry, so not that that matters, but and of course I knew Steve because I used when I was traveling, I which at some point I will again, but spent quite a few trips in Denver teaching for either the Brookfish Institute or Dr. Emily or me. But it ended up being more my stuff in later years just because that's all I had time to do. But I would stop and see Steve. And, actually, I have to say, it was Steve's idea for me to write a book about
Oh,
5 years ago. And I'm looking at him. We're sitting in that little kitchen area back there, right?
mhm. Yeah.
We're sitting at that high top table. It's like, dude, you got to write a book. And I actually probably was kind of rude. I just laughed, like, "Ah, that's the silliest thing I've ever heard." No, no, I'm serious. And it took like 3 years to get it together, but thank you, Dr. Steve, because you were the first inspiration to do that. Uh, but that's a cool place. So yeah, I went there. I saw Perry, and it was the 2 day deal. I did both days, and I just couldn't believe what I learned and what tape can be used for. It
Sure.
can make a huge difference. In fact, I started learning how I can use less tape, and if I place it right with the right amount of tension or stretch, anchor it right and all that, I can actually be more effective with less tape than I used to be with more tape and less effective. This stuff
Mhm.
is fantastic.
It is. One of the most common things our attendees say after taking our courses is, I learned way more than I thought I would. People think,
Mhm.
oh, I'm just going to go in and learn how to, slap some tape on whatever hurts,
Mhm.
and going into the course, you learn, yeah, you can learn some of those applications, but there's so much more that, you can do with tape. And yeah, less is more. You can do a whole lot with a little and just be very, I don't know, wide reaching in what you can do. And yeah, it's tape, it's cotton, nylon, and glue. That's all it is. It's just phenomenal how much it can change, your body, your brain, just with this little piece of tape.
Sorry, everybody, that we lost the connection. I had a little power glitch here, and I think it just interrupted things. So we are back, and Laura was with us. She'll be back. Jan Heller, I saw you in there. Hopefully you come back. Jan is she hosted a workshop at her gym for me in Detroit. 2 of them actually 3 years ago. Amazing. So, and Marco Pani, mi hermano de otra madre, he's watching. And okay, so let's continue. If we back up just a little bit, we were talking about that you have a lot of pre-COVID anyways, and I'm sure now on Zoom, you're in front of a lot of people. You're working with RockTape. For those of you who didn't see this before, this is my favorite and the only brand of tape I'll use. They have lots of different kinds. They have the hydro tape, which is really cool. And they have this, which I love, different colors, different designs. The RockTape Gentle, which is cool. The RX for, they have other products too. I have actually the other one open. This thing is my new best friend.
Oh yeah, it looks a little intimidating, but once you kind of use it, especially if you roll your feet on it, oh, that's my moneymaker right there.
That's my favorite place to use that. I just love it. So you're in a relations position there at RockTape and working with a lot of the people on the front line out there. So let's start there if you don't mind.
Sure. Just as far as what all we do, I mean, gosh, there's a ton of things that we support as far or regarding like what our medical pros are doing. Sometimes they're out at marathons, CrossFit events, obstacle course races, that kind of stuff. Sometimes they're out doing, health fairs, community talks, things like that. And I think one of the really cool things about our product, especially the tape, is it's very visual. If you've been to especially some of these like health fairs that they have, they can be kind of boring. People are just kind of sitting around and, you get the attendees walking through and they do what I call trick or treat, where they just kind of look at your table, oh, what free stuff do you have? And barely make eye contact with you, and then they just scamper off, with your spine shaped pen and, your Hershey's Kisses, and away they go. The neat thing about especially the tape is it's just such a visual, therapy, I guess, or just application. And at this point, most people have seen somebody with kinesiology tape on. The Olympics, it's just every year, boom, 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 and it builds. And, now it's in all of the, major sports and
CrossFit games too. Oh, you ever go to the CrossFit games?
Oh yeah. Yeah. That's actually how I kind of originally got my job with RockTape was because of CrossFit. Yeah. Oh, wow. We used to run the athlete services. So like the non-emergency treatment, soft tissue. We had a team of massage, chiros, PT, athletic trainers, just taking care of the athletes, patching them up, keeping them in the game during the competition. So I was originally brought in to do 3 events. That was in 2013. And then we got invited then to go to help to be part of the bigger team at the games later that year. That's and then I came on in an official capacity very soon thereafter. And oh gosh, those athlete service, it's just, it's chaos. It's, people coming with their, their hands are all torn or they're, just sweaty and exhausted, but they can't wait to get back in there. And it's just such a fun, your clinic is never like that. It's just, it's so different and the days just go by so quickly. And we were very blessed to have an amazing team of med pros out there, donating their time and their skills. And it's definitely trial by fire. Like if you don't know how to tape, or if you're not quick, I should say, you're going to learn. And,
Yeah,
you
right,
know,
right.
and especially even that kind of pivots to sort of what we do as far as like taping at events. So if you're at a marathon, and you're only used to taping, one person in your office in front of you in a controlled environment, then you get out to, a rock and roll marathon, or we've taped at Boston, New York, Chicago, the Disney,
Mhm.
these big, big events, and you've got a line of 30 people and it never ends. The line
Yeah,
just stays that way all day, and you're just one after another. And you can get real good at taping quick.
I'm
I
sure.
mean,
Yeah.
but it's a lot to get used to, and it can be overwhelming. But our team and the people who tend to sign up for these kind of things like
Mhm.
that kind of atmosphere. A lot of them are athletes or compete or do, you know, just sort of have that drive to begin with. Um,
Sure.
but oh, what a good time. But going back to the kind of boring health fairs that can be, again, bringing in tape. When you start taping people, people, they just get drawn to it. And it
Right, right.
opens the door a lot for questions as far as like, oh, you're taping someone's knee. I didn't know chiropractors treated knees, or, stuff like that, that really allows the public to or to see that, hey, we do a whole lot more than you think we do. I
Mhm.
mean, that be chiro PT massage just across the board, especially our providers who use our tape tend to, just be able to offer a lot more to their patients and clients. So, instead of just sitting there waiting for somebody who, maybe has aches and pains and is willing to talk to you about that in a public,
Mhm.
setting uninvited,
Mhm.
versus being, showing them, hey, this is some cool stuff that we can do. And, oh, I've seen that tape before on, I saw it in the Olympics or on, I mean, it's in high school sports,
Sure.
it's just a door that's open. That's, oh, I didn't know, you guys did that or whatever. And then, the questions start coming a lot easier versus just, having that kind of formal, setting where you're just sitting there again, waiting for somebody to come talk to you. It's just something neat that, our products do. Plus, the quality of what we, our materials. I mean, that's what got me hooked on RockTape to begin was the adhesive. I
Mhm.
had used other,
Yeah.
products in school and in practice, and it, you tape a patient on Monday, you see him on Thursday, and the tape wasn't sticking. Especially here in Florida,
Yeah.
we sweat a little bit more and like that. And
Mhm.
my patient, I just stumbled upon RockTape, and my patients on Monday were still coming back with it on Thursday, and I was having
Mhm.
to actually take it off of them, and like, what?
Yeah.
Tape sticks? It's crazy. Um,
Yeah.
just the
It
quality of what we make, so much goes into product development, and again, just the level of materials that we use. They don't just phone something in for the sake of putting a product out onto the market. We want to
Mhm.
make sure we're putting out the best, that we can offer. So that's
And
cool.
it, seriously, anybody who knows me knows I always say this is my favorite, but there's a reason for it because um it's it's the best quality. It does stay on a lot longer through
Mhm.
showers, through baths, I mean
Oh
it
yeah.
does really work. It works so well. Um Plus we've had people a couple times in different areas. It's like, oh, can't we? And this is like a person with Parkinson's. I remember in particular in Austin, Texas. Actually, Steve came and did it after he moved to Austin. So it'll be 2 years ago in May. He came and did like a little guest presentation. Everybody's getting all excited because he taped somebody up front as demo, and then this guy in the back of the room is like, "I want to look like a badass, just like she does. Put some tape on me." He says, "Oh, it looks so cool." I
Oh
actually
yeah.
kind of think it does look cool, quite honestly. I
Mhm.
like it. Speaking of that, this was a project move in the back area with after I took that class with Perry, the weekend thing, and then of course we're all taped up afterwards. So we were sitting in the chairs doing a little interview,
Oh yeah.
and it's not too much in focus, but I have tape all over my legs
Oh, I can see it now. Yeah.
and my
Awesome.
body, and then the partner I had, she's a massage person. and she loved taking the tape off of me because I have too much hair. So there's a way to do it.
There
Maybe
is.
maybe don't have as much hair when you put it on, first of all.
Just a little trim. It goes a long way.
Yeah, it does. It does. It does. But that was a fantastic workshop. I loved it. And then I also went to another one that Steve did in Buffalo. Just I could only go for one day, but I went out just to hang out, and I took the Blades course with Adam
Mhm.
Wolf
Yeah,
3-4 years ago in New Jersey. That was great because there's more talk about the brain than anything, and
so
sensory input
much.
in the nervous system was so freaking cool.
Yeah.
See, I'm such a geek. I love that stuff so much because it can make such a difference.
Oh,
Uh,
sure. And again, I mean, just going back to the tape, even you can, less is more.
yeah,
You can do a lot without really putting a lot of, you know, I don't know. I don't want to say effort because it is an effort, but I mean, just without, putting a lot of tape or pressure of a tool, there's so much can happen with just the lightest touch or just the
yeah,
smallest amount of tape. Our brains are
yeah,
so powerful and our nervous system. And it's so cool again, just how things like tools and tape can have that effect, instead of, drug surgery, that kind of thing.
exactly. Yeah,
It's
exactly. Um, so, so one of the things I wanted to ask you is, since the pandemic started, I think I've seen that they've been teaching some rock tape workshops, virtual, maybe
yeah.
Zoom or something. Now, what
Mhm.
have you been doing with rock tape during the pandemic? I mean, I'm sure things have to have changed for you somehow in regards to your how you're going about your job there. But how has the pandemic affected you and rock tape and all that fun stuff?
Well, I'm home a lot more now, that's for sure. Got
Yeah,
got a
you.
lot of projects done. Fortunately, I have been able to shift a little and be able to, be utilized in other ways. I was
Good.
very lucky with that. I've been helping our education team
Mhm.
work a lot on getting CEs for our virtual courses, our FMT Plus platform. It's our new
Yeah,
on-demand,
yeah.
um,
I
yeah,
need to
that
do
we've
that
been
one.
rolling out, which
Yeah,
well, like, actually, it's not really a coincidence, but totally separate from COVID. I mean, this project has been going on for quite some time. And just
yeah,
the rolling out of it, just, the timing of all of that, and then, everything being closed was just kind of an interesting sort of, all at once.
hmm,
But yeah, I've been working to help, expand occupations that or professions that we can offer CEs to through the FMT Plus platform. I'm
hmm.
also working with our marketing team doing just more customer service across social media. Because,
Yeah,
people have good experiences and people have ones that could be way better.
hmm.
And, we need to be able to, listen to all sorts of, experiences and, improve where
Sure.
needed. So I've been able, and working at events and dealing with people already, it was just an easy thing instead of me being in front of somebody, talking with them about, hey, what was your experience like, or what can we do better? I'm just, behind a keyboard right now, still,
Yeah.
doing very much the same thing.
Well, I mean, we talked a little bit before we went on live the second time, but one of the things about you, even in your emails, it's like I could hear your voice, and I watch your postings, and you're just the perfect person for this role for the company. You're the face of the company. You're out there, you're greeting people, and your energy, your positive attitude, I tell you, that's and your knowledge, it all is like a perfect package. It just it I can't even imagine how much you've helped Rock Tape. I know it's a lot, but you've helped us too on this end. And a lot of us, we need help. I mean, in some way or other, learning
Mhm.
things, knowing things. So I'm so glad that they have you working with them in now in various capacities. That's really great.
Well, thank you. I mean, I really do love what I do, and so much of it just stems from the rock tape of who we are and who we've always
Yeah.
been. And we we find people that are really good and love what they do, and they set us up for success. I mean,
You
I
have a
can,
great team of instructors, that's for sure.
oh my God, we're so lucky.
Got
I
a lot
mean,
of
it's just
geniuses.
big time, huge. But we're able to, draw those people that are amazing and turn them loose, because every
Hmm.
instructor is so different in their personality and, and we celebrate that so much. And it's just,
I love
we
that.
we go to events and we're in our t-shirts and jeans and we look nice, but then you see the next person and they're buttoned up in their suit and this and that, and it's just like,
Yeah.
no, what you see is what you get with us. And we are who we are, and you're going to get a little bit of everything here, but it's going to be amazing because it's really coming from who we are. We don't pretend to be something or someone we're not. I mean,
Hmm.
you're going to see the same MJ in a booth that you're going to see at the bar later on. And I think that kind of flows through everybody.
I'm glad you said that because sometimes I can't think of the words, but you have this authenticity about you. Like I have no doubt that who I'm talking to now is who I would talk to when I see you anywhere else. And that just shines through. That's what we that's what I would like. That's what I personally look for is the people who are being themselves and not trying to put on a front. I understand sometimes if people do if they're nervous, but I
Oh,
just really appreciate the authentic, genuine you. And I think we have people watching you may know. Audrey Nordstrom.
oh, hi, Audrey. She's an amazing singer.
Oh, great. I was a drummer for 35 years. So I might do a band someday. I don't know. Max
Woo.
Streeter,
Oh, Uncle Max. Hi, Uncle Max.
Kelly Sattler,
Oh, Kelly. Hey, Aquinas buddy.
Kevin Bowman, I know from the Austin workshop, right? Kevin, I think you were there in Austin. Giovanni Pagano is a friend of mine. Maggie Morales in Mexico. Maggie, what up? Another fellow drummer.
Awesome.
Jan Heller. Jan, thanks for letting me know you're on your own. You're independent now. So let's book a workshop and we can do Detroit again and we'll set that up. And Laura and Mark. Cool. Thanks for joining, folks.
Yeah.
Yeah, so in the beginning we got cut off because of a power glitch here, apparently. We were just saying how okay, COVID brain just kicked in. I had something really important to say.
Well, while you're gathering your thoughts,
Yeah,
I did want to
please.
follow up on what you were saying before as far as us supporting what it is that you do. And, we had talked about this earlier. Um, just the things that you've been doing as far as the, Parkinson's research and treating and like that. And, my grandfather late, very, toward the end of his life, had Parkinson's, and I wasn't living in town, with them at the time. And, again, I just didn't really feel like I could do a lot to help,
Mhm.
and now just seeing what you've been able to do is just so inspiring that, you know, should I be in a situation like that again, or people that I know, it's just amazing to see that no, there's stuff we can do, and the results, while not guaranteed in every case, the results that I've seen, with you and the people that you're working with have just been so astonishing. It really gives me hope that I can be more of service to people that I love, or that that feeling of helplessness doesn't necessarily have to be there. That it's we
Yeah.
can do a lot more that I think we realize, but sometimes we need to see somebody else doing it.
Well, first of all, I appreciate your kind words. I really do. Okay, Jan, we'll see you later. Let's be. Oh, I owe you information too. I'm sorry, I forgot yesterday. I will not forget to send that today, Jan. Excuse me. But there's a couple of different things. I stumbled upon this years ago by accident. I was a nutrition major up at S Syracuse University SU, and then I ended up working up there. Just as a trainer. And a gentleman came to me. Actually, one of my professors came to me, Jerry, and he said, "I will you train me? I know you work at the gym. I don't know what to do, and I have Parkinson's." I said, "Yes." But I didn't know what to do either because he had Parkinson's. But my son at the time was working on his PhD at Hershey Penn State. This is like 8 years ago or something. And it happened to be Parkinson's related. Like ring, ring, dude, point me in the right direction. That
Right.
was the beginning. That was the beginning. And he didn't know either, but he pointed me in a direction. And basically, there are things specific to Parkinson's, generally, very specific to Parkinson's that need attention. And there's some very simple interventions to help people to move better, reduce
Mhm.
fall risk, maybe slows disease progression according to research, depending upon what it is you're doing. But people with Parkinson's are people too. I always say that because it doesn't define them.
Mhm.
They might have had a hip replacement, open heart surgery, cancer, diabetes, So really anything that we do applies to all humans. Not all humans need everything, but all humans can generally use something. So we had tried 2 years ago to change the name of the brand to neuromotor training. It just neuromotor training, to be all inclusive, because we had people saying like, well, if we knew that it was for people with PSP and MSA and MS and dystonia and dyskinesia and ataxia, we would have had more people here. But when we changed it, we had less people. So it's, but I'm only saying that because we all have nervous systems and a brain, right? And it's a continuous loop. There's really no beginning and no end. And we're humans. So we might have something going on that we need help with. And we're all individual, whether we have Parkinson's or not. And the rock tape in my, this applies to all people. Doesn't mean all people need it, and on the very rare occasion we end up with somebody with a reaction, well, we don't use it, but that's
Right.
so seldom. Do a
Mhm.
little test piece, couple minutes. Oh, you're good. Okay. I mean, it's like a universal everything. I don't know what I'm saying actually, other than I'm always wanting to learn more. That's what it is. That's why I'm
Mhm.
talking with you, is so
Yeah.
that I can learn from you and you can share about what you do. You can share about the company, you can share about anything you want. And then I am lucky on this end, I get to share with an audience who can use the help.
Mhm.
They're interested or they wouldn't be watching. So I just totally went off on a rant, not a rant, a tangent, a Carl tangent. I'm
A
pretty famous.
soliloquy. No, it was great.
I'm pretty famous for those. But I think it's because of the passion though too. And when you
Oh,
say
yeah.
you appreciate what I do, well, I appreciate that you even say that, because really, especially now, people really need help, and they did before. What I mean by that is sometimes just reaching out and say hi
Mhm.
can be a big deal. A lot of people are lonely. A lot of people have pain and they don't know what to do about it. And the pill's not working, maybe from the doctor. Well, maybe something else will work. So the
Mhm.
more we can learn about the tools that are out there to help people, the more we can help people. Sylvia's here. Hey, Sylvia. And Audrey North. Oh, no, Jan. Okay, yeah. Hola, Sylvia. So, so the FMT thing, I think they did some live workshops right before COVID, right?
Uh-huh. Yeah.
I think there was one near me, like Albany, and I couldn't go because I was in Mexico or something. And I need to do that course. And you say that's on demand now?
Yeah. So FMT is just the overall like brand of our educational courses. And then from there,
Mhm.
yeah, we've got, taping tools, compression band flossing, cupping, all sorts of stuff.
Okay. So the
Yeah.
FMT is the at the top of the umbrella with
Yes.
other stuff.
Functional movement techniques. And then we've got, yeah,
Oh,
taping,
oh, that's right. I think
tools.
my shirt says FMT on it.
Mhm. Yeah.
I-
So it's got that
Is
whole.
there is there a relatively new course that's and forgive me if I'm uh, just spacing out on this, but something for personal trainers?
Yeah, we've got a couple new courses that are movement specialist and then mobility specialist.
Oh,
And
okay.
then again, we're working on adding CEs for trainers as well. That's actually one of my projects I'm currently working on.
Hmm. Okay. Yeah. So I've got to get on and check that out. Are those online now, like on demand, or
They
are they?
should be. Yeah, I believe they're both online, like ready for to view, to take. But again, yeah, if you're watching this right now and you need CEs, hold on that just yet. We're working on it. It's pending. But yes, I believe movement specialist is up and rolling. I think mobility, I think they're still finalizing that. But then we've got taping tools, and I think cupping and flossing is up on there too. I should have looked at that again before I came on here.
So I'm if you will, I might know some stuff, but I'm just a trainer, right? I mean, I'm a NASM master trainer. Big deal. And it's great. But so certain things are out of my scope of practice, like blades, although I have a set, so I use them on myself and people who won't sue me. No clients though.
Self-care. You got to take care of yourself,
And the family is the ones. But also for trainers, I think it may vary from state to state, or I don't really know, but I found this tape to be so effective that I use it, where some people say I'm not supposed to. Not to bring up anything bad, but is it out of my scope of practice? No, I'm using it as a cueing technique, and we're allowed to cue. And tape is a cueing, it's sensory input. Just like if I say, do you mind if I touch your shoulder? Stand up straight now. Oh,
Right.
there's a hand. Just a little tap. A little straighter. Okay. So the tape can do this, and I'm not treating pain because it's out of my scope. So I think that for trainers out there, especially, consider where you're at, and if don't run away from tape because you've been told it's out of your scope. I'm not sure how it works state to state. I know that here I can use if I'm not treating for pain, although the outcome is actually the same, right? It's the wording changes. And well, I say that because I want trainers to be able to help people more. Little tape can go a long ways. Take the course. Even if you don't use it, you're going to learn a lot. It's amazing.
And I think as the research continues to evolve, some of those scopes might change, or states might realize, hey, this again isn't just for this one thing, kind of going back to the health fair thing, like you don't necessarily have to be in pain. You can tape for other things. Oh, I didn't realize tape could do that, So I think the more research, the more awareness and education that we can give, these, state boards or just professions in general to see that, yeah, maybe initially that's what we thought it did and that's what it was good for. But wow, there's all this other stuff too that, it can do and you can benefit from. And, hey, maybe if it does help, kind of relieve that ache you had, great. But we're just going to call that an incidental or happy coincidence, because we really want to work on your range of motion right now, or get you, aware of, again, your posture. And posture and form while you're weightlifting, God, it's so key. I mean, you have to have that. You're not going to get the gains, you're going to hurt yourself, I mean, having that extra. Not when I was I was hardcore CrossFit for a while, and when I was working on my overhead squat, I would tape pretty much just along the back of my arm and, kind of down, just so I knew I was, locked out, because I was always afraid, the bar path. I wanted to be so aware of, the weight I was throwing up over my head. And I used tape for it, and people are like, oh, are your shoulders hurt? No, they feel great. But, once I throw this up over me, I need as much feedback as possible, and again, nothing to do with pain. It had all to do with cueing and feedback.
It's a reminder.
Yep.
Right. Yeah, I'm glad you said that too, because it doesn't have to be, let's say, dysfunction purpose, like a purpose of dysfunction, trying to tape up to realign things, or it doesn't have to be for pain. Yeah. I've actually used tape for bruises.
Oh yeah.
Like it's helped myself, because I'm on Coumadin, unfortunately. Well, actually, fortunately, I guess it saved my life. I wound up in Singapore with massive amount of blood clotting in my left leg, 10 inches solid of a clot in the popliteal vein. And, they have good medical there. So I was very lucky in that hospital. Then we moved the workshop, taught a week later. But so since starting the blood thinners a year and a half ago, I bruise more easily. And a couple times I've really taken, crashing my bicycle, my mountain bike, going too crazy on the hills. So bruises,
it
tape.
happens.
A couple of days later, usually the next day, I wake up and the bruise is like 80% gone. So
Yeah.
that's pretty cool how it lifts the skin and
Mhm.
allows for the fluid to flow.
It's such a cool visual too, that, pre and post photo that,
It
you
is.
see, you're like, whoa, something really is happening under there. Like, you don't think like, yeah, I'm sure it does, whatever. But then, yeah, I mean, I've seen it with my own eyes with, myself and patients, just
Mhm.
what a difference 24 hours even makes.
You're not kidding. And the other thing that you mentioned is sometimes I just forget words, but feedback.
Mhm.
So the tape gives you input. That's feedback on your
Yeah.
positioning, right?
Yeah.
You get feedback. I mean, just here because you have more of a, I guess, an awareness of where you are in space, right? Or
Sure.
the
Yeah.
position.
Also, when I was
So
doing
important.
Oh yeah, for
Mhm,
100%. I mean, and for me, it would prevent injury. When I was doing
mhm,
like a heavy deadlift day, I would tape my low back and then extend down, down my hammies. And I didn't have low back pain. It was so I had that cueing to when, if I was getting toward the end or I was starting to fail and cheat a little bit and round my back to, hoist those
mhm,
last couple sets up. It,
mhm.
again, that tape on me would have been like my coach or my trainer with their hand on my back being like, no, you got,
Mhm.
straight, get that spine right and, put that curve back in it,
Right,
and instead
right.
of trying to hunch because, ego and excitement and adrenaline, like you want to get that last, you want a PR, you want to get that last couple of reps. And if you're not paying attention and self aware of what it is that you're doing, you can
Yeah.
get into trouble. So for me, again, that's what I use the tape for. It was just way more input and made me a lot more aware of like, oh, I feel that tape, oh, I'm totally rounding my back, like boom, okay, straighten up.
Mhm.
So
Yeah.
you can use it for helping injuries, but for me, I feel like it's just as valuable to use to possibly avoid injury.
Yeah, that's a great point. And it's funny. Well, I'd thought of that, and then I forget things. There's so many things I'd like to say sometimes, and then I just forget because my mind is going like 10 different directions. Focus, Carl.
I hear you,
Focus.
buddy.
Um, but I just want to put a word out to trainers and just kind of reiterate that whether you feel or whether it actually is in your scope of practice or not to do taping, you got to take the courses because you're going to learn so much about the
Mhm.
body, the nervous system, the brain, and movement. I take the blades course. I mean, take that one too. Take all of them because they're really, really good. They're among my top of the list of favorite courses because what I learned from there, I find myself applying more so than any other course, at least in my thought process around movement and this and that.
Sure.
It's so relevant if we really want to understand, better understand movement and maybe pain and where it comes from. Just there's so much to it, and the brain. Campione is always posting brain stuff. He's got some great stuff
Oh,
he puts up.
yeah.
He's
He's got.
fun too. We have a
Oh, he
ball
is.
talking.
Yeah, and I mean, and again, that's our those are our instructors, and they've got their you know areas of focus that they're just really
Hmm.
into, and and they can bring that into the course. I mean,
Yeah,
yeah, you're
right.
going to get the same material across the board, but you're going to get the instructor spin on it, and maybe
Hmm.
you know a little more of kind of what they do along with, but how it ties into the course. They're not just going to be talking about random stuff, but
Hmm.
it's just our team is just, I can't say enough about them, and especially a capo at the top. I mean, that's
He's the
what
best.
drives the train, and that's what people are attracted to, that and what he's built. And we're just so fortunate to have our core team, and everybody that just awesome draws in awesome. I
Yeah.
feel like I'm just saying the same thing over and again, but
No, it's true though. It's worth saying over again. It's one of the thing I'd like to do someday, hint hint, is if next year all of you instructors do that retreat in Mexico,
uh-huh.
I'll carry all the luggage.
Oh, oh, be careful what you ask for. I'm actually the person in charge of that because we
Okay.
we need all
I'll
of our
carry all the
supplies down
luggage. I'll
there.
pay my own way and I want to be a fly on the wall in the back of the room hearing all what you guys talk about because it has to be like the best meeting of the minds in
It
the business.
is. Oh my gosh.
Okay,
We
I'm
should,
carrying the luggage.
we could stream it and probably charge a lot of money because yeah, again, like we'll just, I mean, I don't have really anything to offer in during that meeting or whatever, I just kind of sit back and again, like you just try to soak up, what's going on. And you're just sitting there and watching just this amazing discussion between just these fantastic, phenomenally intelligent and amazing, professionals. But it's fun too at the same time. I mean, everyone knows what
Yeah.
they're doing, but they don't take themselves seriously. It's in a relaxed atmosphere. We're in t-shirt and board shorts, but
Yeah.
just the quality and the level of what's being discussed is just
Yeah.
it's just a cool place to, cool, spot to be able to just watch it all go down.
Yeah.
Um,
So, it's funny. I have a funny story or three about Adam Wolf. Love you,
Oh,
brother.
no,
Love
I
you,
got I
brother.
got a couple of good stories about
I
Adam
bet
Wolf
you
too.
do. So, a couple can be told, but I'll just tell one. So, I'm kind of joking about that. We had a ball. We were at Mark Carangelo's place, the massage school in North Jersey, and it was a blades course. Adam is a drummer as well, so he knew I was a drummer. He's reaching out, asking some things, and we talked quite a bit. And then I met him the night before at a restaurant. We sat at the bar, and dude, we had a ball for hours just talking about all kinds of stuff. And then he taught me about the vestibular system that night, including doing a positional thing at the testing for strength and then a reset on the floor of the bar. He says, no, you're
Not
going to roll on
surprised.
the floor.
Yep.
So you start on your left side, turn your head. So I did the barbecue roll.
Mhm.
No, I thought he made up the name. No, that's a real name. Well, guess what? When I got back up, he couldn't break me. There was no way. And then he demonstrated the next day too in the blades class. It was out of the really not in the course, but there were extra stuff going on, on breaks and at lunch, and I use that all the time with people. And just that alone has helped a lot of people. So that, like I guess what I'm saying is the amount of knowledge that your team has,
Mhm.
it's just massive.
Yeah.
And that's why I'm willing to carry the luggage.
Well, I hope your karaoke skills are good too, because that's also a very important aspect of the trip.
What's that?
Your karaoke skills need to be on point because that is a
I'll start
very
practicing.
it's an
Is it
event, let
is
me
it
tell
easy
you.
to get out his guitar?
Something, yeah, some people do. I think Adam brought a guitar, Ethan did. I've been during quarantine. I started learning the ukulele, so I'll be. I was hoping to be able to bring it. We had to go virtual on the summit this year, but
Mhm.
that just gives me another year to practice.
Well, I have a year to practice my accordion. I have a mini a
Perfect.
concertina. It's a single row push button, and I'm starting to get better at it, and it's really cool.
Awesome.
We'll have the RockTape band.
Yeah, there we go.
That's cool. Well, so oh, my mom is watching. Hey, mom.
Hey, Mom.
Stephanie Lee, Jody Bennett,
Oh,
and
hey, guys.
Jason James, Garrett, Amy McSpadden, Amy Bragagnini.
Huh.
Those are the newcomers here
Hi,
watching us.
guys.
Jeff Solberg.
Oh, hey, Jeff.
So, well, I've so been looking forward to talking with you, and I appreciate you taking the time. And I have to say one more time, which bears repeating, thank you very much for your support. Please, whoever, if there's anyone I can thank at Rock Tape, please pass that on for me because you've helped me to help my instructor team to help people all over the world, a lot of different countries when we've traveled and
Mhm.
around the states and all that, and it's made a big difference. And so, thank you for that. And so, what's happening this year? What's coming up this year for you and with Rock Tape before we close out? Is anything we should be on the lookout for, like course wise or content
Um,
wise?
just more rollouts on the FMT Plus platform.
Okay.
We're going to be adding more instructor content. So going back to how amazing all of our instructors are and how they've got all their little areas of specialty that they, like to focus on. Actually, I think
Hmm.
Tony Miklas courses are up right now. He's got a shoulder, spine, and knee series.
Okay.
We'll be adding more of those.
Good.
That's kind of the big project. We've got some cool new products we're working on. I can't tell you about them, but I'm
That's fine.
so excited for them to come out. It's
Hmm.
Oh, it's gonna be good. And again, we're constantly innovating and working toward providing not only the best products but education as well. Because again, like I said it earlier that the favorite thing I like about my job and kind of why I think we all sort of got into this field is to help people. So being able to help you and your team help all these other people, it's just what an opportunity to be able to just put some good out there and hopefully change lives for the better. I mean, what
Well,
what what more could you ask for?
we appreciate it a lot, and we feel the same way about helping people as we can. With the foundation I started and whatever, but even well, especially now, I think with the where we're at with pandemic wise and things like that. Like I probably am repeating myself, but with people being lonely
Yeah.
and they just reaching out and saying hi, any kind of positive vibe goes a long way. So Jeff says, "Love rock tape and the protection it gives my hand as an adaptive athlete."
Yeah. Jeff
Fantastic, Jeff.
Jeff is awesome and he does
So
amazing
cool.
things. Oh yeah, he's always up on the mountains and
Whoa, man.
doing super cool stuff. Yeah.
And then I just have to mention the rock balls, these babies here. Okay. This is my new best friend.
Hmm.
This lacrosse ball size. Another very good friend of mine. And then the box they come in looks like this. Um, shit's really, really freaking good. Okay. So there's the tape, there's the blades, and other stuff too. I mean, you guys have a lot of stuff.
Yeah, I've got
Right.
the rock floss, the compression band, we've got the
Oh, the
cups.
floss.
Oh, here I
Yes.
go. I got one of the pods right here. Yeah.
Oh, nice. Yeah, yeah. Floss. I'm gonna get some floss soon.
Hmm.
That stuff looks amazing. I actually had it put on me somewhere. I don't know who did it. Maybe I don't know. It might have been Capo out at Buffalo, but yeah, great stuff. Well, we'll keep a lookout, and of course, you know me. I'll be posting and tagging when I see new stuff from new courses because I like to make people aware of it. And MJ, gracias.
Oh, and thank you. Honestly,
Thank you.
we're just so happy to be a small part of, what you're doing out there. And, you've been inspiring, just on what you've been able to do and help people. It's been great. So, you let me know where you're going next and I got a case of tape headed your way, buddy.
Okay. All right. Well, thank you again. And let's do this again sometime.
Sounds good.
Remember, I carry suitcases very well.
Be
So,
careful what you wish
we'll
for.
talk.
I'm telling you.
I just, I'm going to overdo that one. But, anyways, thank you. All right. And thanks, everyone, for watching. Really
Yeah.
appreciate it. Keep up the great work, Jeff and everybody. And MJ, we'll talk soon. Okay.
Sounds like a plan.
Thanks again. Have a great day.
All right. We'll see you, bud.
Take care now.
Bye bye.
Bye bye.